In this video, we are going to talk about two important amino acid metabolism disorder. One is maple syrup urine disease and another is alkaptonuria. So first of all, let us discuss about maple syrup urine disease. So this maple syrup urine disease is the autosomal recessive disorder. What happens in the maple syrup urine disease is that there is decrease in branch chain alpha ketoacid dehydrogenase. So if there is decreased branch chain alpha ketoacid dehydrogenase, then there will be the blockage of degradation of the branched amino acid. So what are the branch amino acid? Branch amino acid are isoleucine, leucine and valine. So due to the decreased degradation of the branched amino acid, there will be the increased number of keto acid in the blood. So what will be the presentation of the maple syrup urine disease? The presentation of the maple syrup urine disease are vomiting, poor feeding, the urine smells like maple syrup or burnt sugar. There will be the CNS defects, there will be the intellectual disability and ultimately death. So the treatment of this disease is the restriction of the branched amino acid, like restriction of the isoleucine, leucine and valine in the diet. Also the thiamine supplementation helps in this maple syrup urine disease. Now let us discuss about alkaptonuria. So this alkaptonuria is also autosomal recessive disorder. There is the congenital deficiency of homogeneous oxidase in the degradative pathway of tyrosine to fumarate. Catecholamine synthesis, I have discussed that while there is conversion of the tyrosine to fumarate, there is one enzyme homogeneous state oxidase. So this will degrade the tyrosine ultimately into fumarate, and this fumarate will take part into TCA cycle. So in this alkaptonuria disorder, there is the congenital deficiency of homogeneous state oxidase. So after that, the pigment forming the homogeneous acid builds up in the tissue, and this is usually benign. And what are the findings of this alkaptonuria? The findings of this alkaptonuria are the bluish black connective tissues is seen. There is bluish black pigmentation of the ear cartilage and sclera. We also call these as chronosis. And the urine turns black on the prolonged exposure to air. So what happens is that homogeneous acid is toxic to cartilage. So if there is accumulation of this homogeneous acid in the cartilage, there will be the toxic effect. And also the urine turns black on the prolonged exposure to air because the homogeneous acid on prolonged exposure to air is oxidized to corresponding quinones, and when the quinones polymerize, they gives black or brown color. The alkaptonuria also may have the debilitating arthralgia. There is severe pain in the joints. So this concludes our disorder of maple syrup urine disease and alkaptonuria. So important features you have to know is that both are autosomal recessive disorder. The maple syrup urine disease is due to the decrease in branch and alpha ketoacid dehydrogenase, and the alkaptonuria is occur due to congenital deficiency of homogeneous state oxidase in the degradative pathway of tyrosine to fumarate. I hope you understood this lecture. So this sum ups our the two disorder, maple syrup urine disease and alkaptonuria. Thank you.